Look at these visuals. A young 22-year-old man walking on the road collapsed while walking. He reportedly had a heart attack. This incident has been reported from Lakhimpur in Uttar Pradesh. Now look at this. Extremely disturbing, can be triggering for some, but we had to document it just this way. In last 1 month, that is in the month of January alone, at least 5 young people have died of a heart attack, including a 5-year-old child. In fact, 5 have died of a heart attack on camera, and of course, all of this has been reported or caught on camera in a matter of just 20 days, not even 1 month. And this is only those, as I mentioned, that have been reported. An engineer died of a heart attack while playing cricket in Uttar Pradesh's Noida. A student collapsed in a coaching institute with a heart attack while the class was on. Uttar Pradesh's Amroha, where a young man died while he was cleaning a car. A 5-year-old girl, Kamini, died of heart attack while watching cartoons on a mobile in Uttar Pradesh's Amroha. And there are more instances. What are we really looking at? I'm right now being joined by N.N. Khanna, senior cardiologist and advisor to Apollo Group of Hospitals. Thank you very much, doctor, for joining us at this point. My first question to you really is, what you have heard me speak at this point, is it alarmist or is this a genuine concern?
No, this is definitely alarm, and all of us have to agree that we are seeing more and more cardiac arrest and even acute coronary syndromes in young people. And this is of concern, not only in India, but even outside. And there are a lot of things which come to our mind. It could be a late COVID effect, it could be a vaccine effect, and many a time we should also not miss out on, congenital or genetic causes of cardiac arrest, which are now being thought as, everybody who has a cardiac arrest, we think it's because of acute heart attack, but these are not acute heart attacks. They're actually acute cardiac arrest because of electrical short circuiting in the heart and ventricular fibrillation. And many a time they have genetic cause, could be cardiomyopathy or myocarditis, which could be many a times related to this post-vaccine or late COVID effect as well. And I'm not too sure. There is a lot of concern about pollution as well.
Doctor, what we are seeing, I mean, as we have mentioned, and we really don't have any data to go beyond this at this point, but we have 5 instances that have been reported in just last 1 month. If you look at 2023, there have been several such instances that have been reported, but that was over a span of 1 year. Now we're talking about just what's happened in January. One school of thought may say, these are just that are coming before the media because these are visuals that are emerging. But as doctors, do you see this as an unusual trend? Is this something that you are seeing more often? Is this something that is not just to be ducked under the carpet as possibly only a lifestyle issue? Or is it something beyond this? I mean, we're just trying to understand as laymen when we are reporting something like this, what's the perspective we need to have on this?
Definitely, I would agree. It is not, a usual thing. It is a thing which is unusual. It is happening probably too often. It has a clustering phenomena, and we are really concerned as doctors and cardiologists. We are really concerned to find out what is the cause. But definitely, the incidence is more, and these are the things which I told you could be the cause. It could be viral myocarditis, late COVID effect. It could be maybe related to vaccine or pollution, or maybe these are cardiac arrest which happen because of congenital cardiomyopathies or electrical instabilities of the heart, and they are triggered by these lifestyle changes. So it is definitely a concern, and it is not something to be dumped under the carpet. It is of concern, and it is becoming more and more noticeable now.
Doctor, for the government that is looking at, who may be hearing us, for the authorities who may be hearing us, for the Indian Medical Association that you may be well part of, what should the next step be? Because there have been enough debates, discussions, awareness programs, even on mainstream media for that matter, about these instances that have been reported time and again. Now, what should the next plan of action be? What should the government be doing? What should the doctors be doing? Do we now need to get into a point where there needs to be some study, some academic study to figure out what's really wrong? Is there a way out on that?
Yes. So what should happen and is actually started to happen is that we are trying to collect the national data from different states and the various risk factors which could be possible. And such studies are observational studies are going on probably in every state of the country. But by the time we will have some conclusion, it will be a year or two before we can actually conclude because many of these patients, we sometimes we do not know the cause. These sort of studies are easier done outside India, where all these deaths undergo a postmortem, and we can actually know the exact pathology. But in India, because the postmortems are not there, done in these patients, so it becomes a little difficult to answer and pinpoint the exact etiology. But exactly, but if you do more, if we get more numbers of patients, then in association with the risk factors, we will definitely come to a statistical conclusion. What are the important risk factors and why this is happening?
Right. Dr. Khanna, I mean, when you began in the beginning, you spoke about several possibilities. While that may really be in the medical, it will be part of the medical fraternity to decide on that. What should people like our viewers and I, what should we be doing?
Okay, so the first important thing which everybody should be knowing and doing is to identify such patient who suddenly become unconscious and make sure that there is a cardiac arrest, that there is no pulse, and in those sort of situation, everybody should know how to do a cardiopulmonary resuscitation. If we know the basics of cardiopulmonary resuscitation, which everybody should know, actually we can save at least 50% of these patients, and then they can be, shifted to the appropriate hospitals, and where the exact cost can be determined, and these patients can be treated, and such things can be prevented for future. But if you really want to save life at this stage, uh, good knowledge and practice of CPR is a must, and it should be taught right from the school children to even illiterate people, to the street, hawkers, to bureaucrats, to teachers, everybody. And there should be more and more
No, you're
availability
making a
of.
very important point, doctor. Sorry, I'm interrupting you at this point. But we need to just drive this point home, and it needs to be driven very strongly. They need to know CPR. And let's face the facts. I have been asking people around me over the last 1 month, while interacting with people across strata, whether they know CPR. They know about CPR, but they don't know how to do a CPR. And I would want you to spend a minute on the importance of this. Before you do that, just the visuals that we have before you, none of these instances where you see a student collapse in the coaching institute, you don't see the young people around him reaching out to do a CPR. The techie falling down, you see some action on the ground, but the CPR was not done. The person who fell on the road, there were people around him, but no CPR was done. The child, the 5-year-old child who a doctor suspect died because of a heart attack, there was no CPR done. These are all instances that have been documented with no CPR that was made available. Now, we don't know what would have been the outcome if CPR would have been done. We don't know that. But doctor, I want you to spend a minute explaining and driving this point to our viewers. If they're watching and they don't know how to conduct a CPR, just how important is that?
Okay, so let me try to answer this. Once you have a patient who has a cardiac arrest, that means the heart is not beating. the patient actually becomes unconscious because there is no circulation to the brain as well as to the heart and any other vital organs. Now, if you look at the timeline, the brain has only 2 to 4 minutes to survive. If the brain doesn't get that sort of a circulation back, the brain is not going to be permanently dead. Or even if you get it back, in some instances, the patient would be in a vegetative state. For heart also, if you can get the circulation back within minutes, then it is fine. Otherwise, the heart doesn't come back. Now, how do we do it? We actually make sure when the patient gets to this stage, have the patient lie on the back on a hard surface, which could be the ground itself, and then you have to make sure that the airway is good, so that somebody has to either pull out the tongue or puts a gag on the mouth so that there is no tongue fall, and then somebody has to compress with a hand like this or like this onto the chest, and these compressions have to be really strong. The compressions have to be at a rate of around 80 to 100 per minute, and they have to be strong that the sternum, which is the chest bone here, actually goes down by 2 to 4 inches, and it sort of compresses the heart, and then once you release
Right.
it is like a mechanical circulation which is established. If you do that, you can actually maintain blood pressures of around 80 to 100 and sometimes more, and these are good enough to actually maintain circulation to the brain and get heart back to its normal electrical activity. And once the patient goes back to the spontaneous circulation, these patients actually will revive. 50% of them would revive, and then you can shift these patients to the nearest hospital and find out what was the cause, whether it was a heart attack or it was an arrhythmia
Right.
which precipitated this, and subsequently one can treat this in a proper way. So this should be, it is a very easy thing,
Right,
but
doctor.
I believe to start with, it is the doctors and paramedics who actually should take the onus and teach as many people as possible around their vicinity. That means doctors living in communities or in condominiums should actually get other guys and teach them on a weekend that this is how you can do a CPR and save them. Teachers should teach their students, paramedics should teach their fellow beings all around, and this should most of the patients very effectively. And the importance is it has to be started as early as possible. There's no point, as you saw on the visuals, that patients, I mean, people wait and then they think what to do and then they react. The reaction time is after 4 or 5 minutes. That is very risky. It has to start immediately.
How soon should the intervention be? The first response that emerges. Within how many seconds or a minute should that be?
It should be immediately. You have to just make sure that the patient is unconscious and there is no pulse and the heart is not beating. So if there is no pulse and the patient is like unconscious, just start straight away.
Right. Right, doctor, before we wrap up, we are highlighting cases that are happening to the young. We're not getting those beyond a particular age at this point because heart attacks usually would have been seen as something that was possible at that particular age group. We're looking at people who are young and who are succumbing to heart attacks or whatever the medical term for that would be. One, in a minute, if you want to wrap, what would you want to tell the young who are listening to you?
One, I told you the importance of CPR. Identify such patients around you and do a CPR.
Absolutely.
You can actually save one or two lives in a span of 1 or 2 years, and that would be one of your achievements in life achievements. Secondly, people who have tendency to have syncope or falls or blackouts should actually consult doctors quite early, because that could be one of the warning signs to get. Second thing is, if people have risk factors for coronary artery disease, they should actually go ahead and get them investigated, irrespective of age. And people who feel breathless, especially after a viral infection or post-COVID or a vaccine, then these patients also should actually get themselves tested by a doctor. Many a times the heart becomes weak and very susceptible to electrical short circuiting, and people do not know. They may just have a little breathlessness or almost no symptom, and they may end up with this.
Right. Right. Dr. Khanna, can't thank you enough for joining us, for adding much to what we are looking at. Important perspectives, important information. I do hope we leave our viewers more equipped than when they started listening to you. Thank you very much, Doctor.